Assalamualaikum and very good day to everyone. We from Center for Medical Imaging Study, Faculty of Health Sciences, UITM Selangor present our project entitled Low Cost Ultrasound Phantom for Image Artifact Lockup. The content of our presentation is stated. These are team members contribute in this project. As introduction, imaging techniques like ultrasound are critical diagnostic tools used for assessing and evaluating tissue abnormalities. However, ultrasound procedures are becoming more challenging over time as diseases become more complex. Thus, there is a need for excellent and reliable training method. Before training on the live patient, operators should learn to identify ultrasound artifacts. Currently, in the market, we have first general purpose ultrasound phantom, second imaging guided biopsy phantom, and last one organ training phantom. However, a commercial ultrasound phantom can be costed from $200 up to $3,500 depending on the type of phantom. No image artifact phantom available in the market for training and teaching purpose. Therefore, our objective of this project is to construct a simple, homemade and low-cost phantom suitable for basic training in ultrasound artifact, understanding and identification. In this project, we focus on the 5 common artifacts such as posterior acoustic enhancement, posterior acoustic shadowing, mirror image artifact, reverberation artifact, and comet tail artifact. So first one, construct process artifact. So posterior acoustic enhancement is characteristic of fluid field structures such as the cyst, the gallbladder, and the urinary bladder. First, a latex glove is filled with a tap water. Then, the distal portion of the glove, finger portion is tightened. One of the finger portion was tightened and cut off the blue dashed line and final product of fluid field structure. This is the lockup image presentation of the posterior enhancement, and the image on the left represents clinical image appearance of posterior acoustic enhancement cyst in the breast. Next, posterior acoustic shadowing is a characteristic of dense, solid and closely packed structures such as stones and bone. To produce posterior acoustic shadowing, a stone is used. We use an irregular surface stone, the red asterisk in the posterior shadow from the lockup phantom, and the image on the left represents a clinical image of a stone from the gallbladder. Next, mirror image artifact is seen when there is a highly reflective surface such as diaphragm, the part of the primary beam. A clear plastic container lid is used to create a highly reflective surface, and then a fluid field structure mimicking a lesion is attached to the plastic sheet. Both materials were placed closely and submerged into the ultrasound gel tank. The green arrow on the lower right image shows the mirror artifact from the lockup phantom, and then the white arrow on the left image in the mirror artifact of liver hemangioma from patient. Moving on is the reverberation artifact. Occur when an ultrasound beam reflects back and forth between two strong parallel reflectors. To create the reverberation artifact, a flexible PVC cable was used. The wire within the cable was pulled out, thus creating a hollow space within the cable, yellow asterisk. The pink arrow on the right lower image shows the reverberation artifact from our lockup phantom. Then, the yellow arrow on the left is the reverberation artifact found in the urinary bladder. Last one, comet tail artifact, is a form of reverberation between two closely spaced reflectors, causing the echoes to be displayed as triangular lines. The pull-out wire from the flexible PVC cable were pressed closely to create a narrow space between them. The wire were used to create a comet tail artifact as shown by the red arrow. The yellow arrow pointing to the comet tail artifact in the patient who has adenomyomatosis in the gallbladder. To visualize the image artifact, all the material used to create artifact must be submerged into a medium to create a transmitting medium. Commercial ultrasound gel or homemade ultrasound gel using starch base is suggested. Conventional ultrasound was performed using an ultrasound scanner and a linear array transducer. All the materials were submerged in a container filled with ultrasound gel. Using a linear transducer, we scan the lockup phantom. From the screen, we can see the stone is casting a posterior shadow. The total cost of this project is less than 150 ringgit Malaysia. All images were assessed by 4 sonographers from 3 different hospitals. Based on the kappa coefficient, it is shown an excellent inter-observer agreement during image assessment. The image appearance of ultrasound artifact created using this homemade phantom closely resembled the image artifact that routinely seen in the clinical setting. Our project provides an easy example for beginners to start making a phantom for themselves, potential supplementary material for better teaching. Our project is relatively quick and easy to construct. Lecturer can effectively teach more learner the process of the image artifact formation and identification at much more reasonable price. So that's all from us. Thank you so much.